Time for Medical Monday. Dr. Heather Stefaniak with BayCare Clinic here to talk about something truly unique, using Botox to help with overactive bladder. So let's start off. What is overactive bladder?
Overactive bladder essentially is, the bladder is a muscle, and sometimes it can contract when it shouldn't. So what people can experience is a sudden urge to urinate. Sometimes that leads to urine that is expelled when it shouldn't be. So it's essentially an urgency, a frequency, and sometimes incontinence because of that.
Is there anybody who's maybe more susceptible to this?
More common in women, but men can definitely deal with it as well. People that drink coffee and caffeinated beverages and things like that, that's a bladder irritant, and those people can definitely have more urgency and frequency.
Absolutely.
Sometimes medications can cause more urgency and frequency.
So lots of people can have this symptom.
Definitely.
Okay, so Botox. We all know Botox. We always think face and, you know, no wrinkles and things like that. Sure. How did you decide, or how did you learn to use this for overactive bladder?
Well, Botox has been used in the bladder for many, many years for people with neurologic type issues. So, MS or spinal cord injuries. People use MS in the bladder to calm the bladder down. 2013, it was approved for people that do not have a neurologic condition but still have overactive bladder. So we've been using it in the office for the last few years, and it's been pretty amazing. So the bladder itself, as I said earlier, is one big muscle. So the concept is just numbing that muscle, not to the point of not being able to urinate, but enough that there isn't urgency and frequency and leakage.
How do you do it? I mean, what is the treatment like?
Usually people should expect, I mean, there's typically a workup. I mean, it's not someone's just walking in saying, I want Botox. But if they've failed other medical therapies, we do a workup, and the procedure itself typically involves the day of, they give us a urine to make sure there's no infection. We essentially put a little numbing medication in their bladder. So they don't feel the procedure as much. But the active part of doing the procedure is a scope. I do 15 to 20 little pokes throughout the bladder. And people may feel a little pressure during that, but the whole procedure itself is about 2 minutes.
Oh my goodness.
Then we make sure they can urinate at the end of the procedure and go home. So it's an in-office, there for an hour. Typically it starts kicking in within about a week or so. And the hope is that they're not in pads, they don't need to take medication for their bladder, and I've had some very happy patients, and and we can have people giving us hugs and crying in the office. It's pretty awesome.
That's exactly what you like to see, positive results.
Definitely.
Awesome. Thanks so much for being with us, doctor. For more information about using Botox to treat overactive bladder, just visit our website and click on the Wisconsin Tonight tab. Well, there is so much